send an SOS to the world. I send an SOS.
Good afternoon. Brittany Madison, you're a nurse practitioner working here in Jupiter, Florida. And I'd like to have you help me with some questions and concerns that we have about the coronavirus.
Well, I'm concerned that people in South Florida are not social distancing, not following the CDC recommendations. If they are exposed to someone who has tested positive or even has symptoms of COVID, the guidelines are there for us to follow. And certainly with the number of cases rising in South Florida, it makes it apparent that there's a lot of people out there that either don't understand the severity of it or are just choosing to ignore it. So I do have concerns about that for sure, especially with how many patients we see on a daily basis coming in and out of our office. Just want to make sure that people are following those guidelines to prevent more spread of the virus. At the beginning, everyone was so worried and overly cautious. And then we had this little dip of people feeling like, oh, I'm okay. I'm not pre-exposed to any problems with my health, so I can go into Publix without wearing a mask. And people got this false sense of security. So I'm hoping that now there's a shift going in the right direction. But yeah, it's a little bit hard to tell.
So what steps do you think could be taken now moving forward by government?
Well, I kind of have two thoughts on this. So first, I want to say that I think that they are really doing the best they can. And this is a really hard situation that everybody's been put in. And, I think that the government on all levels has good intentions, and they're trying to make sure that this virus doesn't get more out of control. But at the same time, we're trying to control a lot of people that don't like to be controlled. So I think that the best that they can do is make things mandatory, because we've seen that if they make strong suggestions for protocols, people don't care and they do what they're going to do. So I think the only way to make big changes that stick is if they mandate.
So Brittany, you have a young son at home. What's it like to be a working parent in the pandemic?
It's interesting, that's for sure. Again, going back to the social media presence, everybody has an opinion. It's not an easy answer for anything. So being a working parent during the pandemic has had its challenges. Fortunately, my son is at a preschool that did close at the beginning of the pandemic and chose to reopen in June. And they have changed their protocol with the health department's guidance and with the CDC's guidance. But, it's controversial. I have friends who don't understand how I'm comfortable sending my child to school. I don't know 100% that I'm comfortable sending my child to school, but it's something that we're having to figure out here as we go. It's been a challenge for sure.
How have you explained this pandemic to your son?
That was one of the hardest things at the beginning. As adults, we can learn to cope and figure out how to work from home and things like that. But I was actually surprised with how well my 4-year-old coped with this. We're very social people. I love to take him out and go on, we call them our adventures. We like to go out to public places and go to the zoo and go to the park. And we had to explain to him that there's a lot of sick people and we have to all wear these masks. We have to wash our hands, and you can't go out with mommy to the grocery store, or you have to stay home. And at first he didn't really understand, but he caught on really quickly. And now he understands that we wear masks so we don't spread germs, and we wash hands so we don't spread germs. And they understand that on a local level, it's changed a lot of what we've been able to do socially.
I'm not sure a lot of adults understand it, by the way. So that's, how about out of school? Do you have play dates? Does he play with other kids? And if so, what kind of precautions do you take, not just with your son, but the other kids?
Yeah. For the first couple months, we saw no one. It was just who was ever my family in my house. And even, that brings up another issue. We had to have a lot of discussions with my family of which family members get to come over and how we figure that out. So as far as play dates went, no, we saw no one for a couple of months. Even now, we are fortunate to live in a very young family neighborhood where there's a lot of kids roaming around and a lot of kids knocking on doors to play. And even now, if we see people outside, we kind of decide case by case who we're going to stop and talk to, who we're going to keep riding our bikes past. You kind of, you have to make decisions, but we haven't done any indoor play dates. We haven't gone to anybody's houses. We've done a couple of outdoor, like park play dates where the kids can just go kick the ball around. And that's pretty much the only thing they're touching there. But yeah, no indoor play dates yet. Besides, of course, he's at school all day. So once he's home from school, we're not going to anybody else's houses. So many different discussions and so many different points of view. Like we said, there's no correct answer, but I have friends who haven't left the house since March, who have taken leaves of their jobs and who have stayed at home with their kids and not seen anybody or gone anywhere. And some of those parents are actually sending their kids back to preschool in the fall and are hesitant, of course, but they feel like their children's mental health and socialization outweighs the risk of the virus for them. Knowing what the preschool's protocols are, they're comfortable with that. Now, on the other hand, I am good friends with a few teachers who have completely opposite thoughts. So now you're talking about a teacher having to go to school and have a videotaped lesson. They're going to have video cameras in the room so that the school board sees that they're teaching or using that time wisely. And their children are now having to be at home with a nanny or another parent or a babysitter because they can't come into the school with them. So that's one issue I'm hearing from teachers. There's teacher friends of mine who don't have kids who are also very hesitant to get back to the classroom. The data that I looked at even this morning was showing that for children under the age of 15 and all of the reported positive cases around our country, the mortality rate is still 0 to 0.2% from COVID. So we're talking less than flu mortalities. And unfortunately, even if one child dies from COVID, it's a tragedy, of course. But, it just becomes really complex with, well, what's different with this versus the flu? Do we close the schools every time the flu is rampant? And nobody knows what the right thing is to do right now. But all we can do is go with the guidance of the CDC recommendations and see how this virus is going as far as the numbers and the mortality rates, and see which age group it's affecting the most. And right now, it doesn't appear to be affecting children as much as adults or immunocompromised people. But we haven't had hordes of children together in one place in a couple of months. So that's the concern for the fall.
When they developed the CDC phases for reentry into opening up the economy, we really didn't have a good idea of the airborne aerosol transmission being able to reopen faster or more safely if they convert to open air environments where they have the kids outside. Can they even teach kids, especially your preschool age kids? Can they teach them anything outside, or is virtual learning going to be better? And will it vary depending upon the age group that we're talking about?
I think age makes a big difference. I 100% agree that being outside is safer, being in open air is safer than being indoors. That's been proven. I think if you take 4 and 5-year-olds, anywhere up to maybe, first, second grade, I think if you take them outside, there's so many distractions, noise distractions, weather distractions, heat, rain, snow, whatever it may be. I think for the older school age population, outdoor learning is great. I actually remember doing a lot of outdoor learning when I was in high school and loved it. But, it has to be, the stars have to align to have it be nice weather and the right population. But if they can figure out ways to do that, I'm sure I'm not sure. I would hope that the schools are considering options like that for resuming back in the schools. I think if you bring 4 two to 6 year olds outside and ask them to focus on something, educational. What if they're not doing something playful? It could be a little counterproductive, but for the older population, I think that should be a great plan that they're trying to consider. And even with the younger age, it's not that they can't be learning outside. School's not as structured when you're that young. So I think it's fine for them to be doing outdoor activities, but it's just not as focused as being actually inside the classroom. And then also with that young age group, their attention span when looking at a screen just at their friends and their teacher. Now, if you put a game in front of them, they'll sit there for hours. But if it's an actual Zoom call, we did that over the summer. And I mean, it's about a 10-minute attention span, and then we're on to the next thing. So it's a whole different story being virtual at that young age versus being in the classroom or in an outdoor classroom setting, I guess, if that's an option.
Yeah, and right today it's all rainy and lightning out here in South Florida. So I could imagine if today was an outdoor learning experience, there wouldn't be any learning going on.
Right.
Let's get even younger. Premature births are going down. Apparently, the study that came out recently that I know you're aware of shows that across the world, the number of premature births is plummeting during the pandemic. Tell us a little bit about that, Brittany.
Well, I have a personal, interest in this story because my son was born at 31 weeks and had a grade 3 brain bleed. And fortunately, now at 4 years old, you would never know it. And he's very healthy and developmentally and socially on track. But, trying to get to the bottom of premature births in healthy pregnant women is something that is very interesting to me. And I've always, been very involved in cases like this and wanting to learn more. And I think it really is telling. And if this article and this research can lead these scientists and researchers and obstetricians towards a direction of trying to figure out why some of these premature births happen, then that will be amazing. So I believe the article was saying that they're finding that during the pandemic in certain parts of the world, not in all places of the country, but in some places in Europe and even some places in America, premature births have gone down because women are at home and resting, maybe controlling their eating, their diets a little bit more, maybe not doing as much activity that's causing them to be at risk for a preterm delivery. So if this research is proving to be some new data that hasn't been seen before, that will be something extremely positive that comes out of this pandemic. And if they're able to see that an earlier maternity leave and earlier rest for the later stages of pregnancy can prevent premature deliveries, save thousands of dollars on healthcare dollars, both on the mother who's recovering, as well as, of course, the infant who is now in a NICU and has all kinds of medical problems that will need to be followed by specialists for years, as well as the mental trauma that comes to family and children from having these problems. Man, that would be a huge breakthrough in this research if that gets them going in a direction, all because of what's happened during this pandemic with people being forced to slow down a little bit.
It is nice to see a silver lining in this pandemic. It's hard to find them, and certainly that seems to be one. Anything else you can think of that you'd like to tell us about?
I think it's just more important now than ever to focus on your health from the inside out, healthy eating, healthy exercising, washing your hands, cleaning surfaces in your home, teaching your family about health and wellness. This is, again, another little silver lining, is really taking the time to focus on your health. There's a lot of people that are working from home right now who have been furloughed, who have been laid off from their jobs, and this is a perfect time for you to focus on your health in whatever way you can, because most of us, or a lot of people, have been given an opportunity that they never would have otherwise to focus on themselves for a little bit. So overall health and health when you're going out in public and putting others at risk is just really important right now. And I hope that everyone takes that very seriously.
You know, when this pandemic started and we first learned about the novel coronavirus, it seemed that it was a respiratory illness primarily, and we now know that it's far more than that. But the question of vaping and nicotine addiction was a big deal earlier, months ago, and it seems to have dropped off the radar screen. And we know that vaping has not stopped. If anything, the number of Juuls purchased across the country, from what I understand, has increased during the pandemic.
Right. Well, so vaping and COVID is exposing us to two relatively new, and very severe respiratory problems. So my knowledge of people who vape and who use Juuls, it tends to be the younger adult, adolescent population. I know that's not all inclusive, but my personal feelings on that age group is that they learn from personal experiences. So I think that sometimes that age population has to see something firsthand happen to someone they know or to themselves to really understand it and get it. And I hope that doesn't happen for everybody, because it's too late at that point. But I really hope that people who are vaping, using nicotine, smoking cigarettes, whatever form that they're using, really understand that it's increasing their risk of having a complication from COVID, or putting them in the hospital, putting them on a ventilator, or possibly dying from COVID if their lungs are not strong and if their health is not in an optimal state going into getting this virus, because this virus is just very strange, and it's definitely affects your respiratory system. So I would be very concerned if someone that I knew was vaping and using Juuls.
Drug addiction, overdose, drug misuse are all increasing, along with the anxiety and the depression and the social problems that are being fueled by the pandemic. Mm-hmm. And in your field, I know that you have a lot of experience in seeing patients, not as a mental health provider, but certainly working in a spinal surgery practice. You have to deal with the mental and emotional aspects of patients, perhaps more than most that are not in mental health fields. Where do you see this going with the pandemic and economic problems and school reopenings? It's a big, complex mess, but what could you offer as some guidance for all of us?
Yeah, it's a terrible problem that we've seen over the past couple of months. I was doing purely virtual telehealth visits with patients for a couple of months while we were working from home. And so many times that I talked to patients, even now that we're back in the office, being very careful with seeing patients in person, it's a common theme of a lot of our patients to say how depressed they feel during the pandemic, and how they've been drinking more, or they've been taking more medication, because the depression is just causing so many symptoms they're not used to. Definitely seen an increase just in the data with medication use and alcohol use during the pandemic. So I think it all ties in with your mental health for sure. So even with the kids that we were talking about going back to school, mental health is so important. And fortunately, there's a lot of awareness now in our country towards mental health. There's certain populations that are really at an increased risk for having mental health problems. And I think it's something that definitely needs to be a consideration. One of the considerations that people are making when it comes back to going back to schools, opening businesses, getting people back to work safely, which is not easy to do in some businesses, so that they not only can not get in a financial drought and not be able to support their families, but also be able to stay social and get what they need, get the treatments they need, see the doctors that they feel comfortable seeing. People are scared to go to the doctor right now, some of them. We have patients in our clinic who are just scared to go get MRIs or scared to go get tests that are recommended, which otherwise they would need and they would willingly go get if we ordered for them. Because there are so many people that know that they're at risk for having a complication from COVID, and they just can't leave their house. So they're becoming depressed. They're not socially around people. Our elderly population, who, if they live in a nursing facility or an assisted living facility, they have to quarantine in their room. My grandmother has to quarantine in her room by herself for 2 weeks if she leaves her facility. She's 86 years old and she doesn't want to do that. So she's not leaving because she doesn't want to have to sit in her room for 2 weeks when she comes back, which would be a mental catastrophe for her. So yeah, back to the substance abuse, it goes hand in hand. We know that mental health and substance abuse go hand in hand. So get outside and go for a walk, where you're not going to be around other people. Get the vitamin D, get the sunshine. If you feel like you want a glass of wine at 10 a.m., try to go walk around the block first and see if you still need that glass of wine after you take a walk. Whatever it could be, that whatever advice I could offer a patient to prevent them from using or abusing, it's not easy, and it has to be individualized per patient for whatever they need. But yeah, I know there's a lot of concern for that right now with the mental health of adults and children.
Thank you very much for spending some time. I know you're on a busy day today, and we will have you and your family in our minds as we get closer to the school year and we get closer to learning if in South Florida we're going to go back through another shutdown of some sorts. We have kind of a partial shutdown right now, but I do appreciate you spending the time. Brittany Madison, nurse practitioner, trained in Miami, working up here in Palm Beach County. Thank you very much.
Thank you, Dr. Dave.
Walked out this morning, don't believe what I saw. 100 million bottles washed up on the shore.